Welcome back to the deep dive. So today we're digging into something pretty fundamental, actually. How much do we really know when we're making those big healthcare calls?
Yeah, it's a huge question. And it often boils down to this idea of um, health literacy.
Right, like can you actually find, understand, and then use health info effectively, especially when it comes to maybe avoiding what they call low value care?
Exactly. And, there have been efforts, campaigns trying to tackle this, like choosing wisely.
Oh, yeah, I've heard of that one.
Its whole goal was to spark conversations, get patients and doctors talking, asking the right questions.
Yeah.
But the big question hanging over it is, well, do these tools actually work for everyone, regardless of their health literacy level?
That's the core issue.
And that's where this Australian study comes in, Muscat and colleagues. They ran a randomized trial looking specifically at this. They tested those choosing wisely questions and also a video about shared decision-making, or SDM.
Okay, so what did they find? I'm guessing the tools help those with lower literacy more?
Well, that's what you'd think, right? But here's the first kind of surprising bit. The study found that the questions and the video, they didn't actually have different effects on outcomes based on health literacy levels.
Wait, really? So giving people these tools didn't particularly level the playing field between those with limited versus adequate literacy?
Not in terms of boosting question asking or decision making differentially in this specific test, no. Which, like you said, feels pretty counterintuitive.
Hmm. So what's the point then?
But this is where it gets really interesting. While the interventions didn't show that specific differential effect, the study did an amazing job highlighting the baseline differences that health literacy creates before any intervention even starts.
Okay, tell me more. What kind of differences?
Well, for starters, people identified as having limited health literacy. They just knew less about their rights and shared decision-making compared to those with adequate literacy, like 82% versus nearly 90%.
That's a noticeable gap already?
And their attitudes were different, too. Fewer people in the limited literacy group felt positive about engaging in SDM, about 48% compared to 58%.
So less knowledge and maybe less enthusiasm for that shared process.
Exactly. And crucially, they were also more likely to say they just follow a low-value treatment plan without really questioning it.
Right. And we should probably clarify low value care again. It's
Okay.
basically treatments or tests that are, not very effective, maybe even risky, or just offer tiny benefits for a big cost or effort.
Precisely. Like getting an unnecessary scan just in case when it's unlikely to help and might lead to more anxiety or invasive tests.
Hmm.
The study showed those with limited literacy also came up with fewer questions along the lines of what choosing wisely promotes.
And what are those questions again, just to remind everyone?
Sure, they're pretty direct. 1, do I really need this? 2, what are the risks involved?
Okay.
3, are there simpler, safer options? 4, what if I just wait and see, do nothing right now? And the 5th. 5, what are the costs? Not just financial, but maybe time off work, side effects, that sort of thing.
Those are really powerful questions to encourage.
Definitely. They aim to get you and your clinician thinking together.
But, okay, amidst all this, you mentioned something positive earlier.
Yes, this really stood out.
Yeah.
The participants who had limited health literacy, they were actually more likely to say they'd use the video interventions again.
Oh, interesting. So even if the immediate measure and outcome wasn't different, the tool itself resonated more with them.
Exactly. About 68% of the limited literacy group said they'd use the video again, compared to only about 56% of the adequate literacy group.
That's quite a difference. What do you make of that?
Well, it strongly suggests that the format matters. Maybe the video format is just more accessible, easier to digest, or more engaging for people who might struggle with written materials or complex explanations.
That makes a lot of sense.
And the practical takeaway here is pretty clear for policymakers and clinicians. We can't just assume a one-size-fits-all approach works. People with lower health literacy seem to need different, more targeted kinds of support to really engage.
So we need to think beyond just leaflets or standard web pages.
Absolutely. We need to develop and really test different formats. Like these videos may be making them super easy to rewatch after an appointment, perhaps online or through an app.
Yeah, because you might not remember everything in the moment.
For sure. And this ties into another growing area too, digital literacy. Especially now with so much telehealth, we need to consider how comfortable people are with the tech side, alongside the health information itself.
Right. It's another layer of potential barriers.
It is.
So Wrapping this up, our deep dive suggests it's not just about what information we give people, it's really about how we deliver it. We need smarter, more tailored approaches, maybe leaning into things like video to make sure everyone feels empowered.
Absolutely. And maybe the final thought for everyone listening is this. How can we all push for healthcare interactions and tools that genuinely work for every single person? How do we build systems that truly empower everyone, regardless of their background or literacy level, to ask those vital questions and bridge that health literacy gap for good?